Step-by-step guide. Are we doing birth all wrong? Step 1. Understanding the current birth practices. 1. Hospital births. Recognize that the majority of births in many countries occur in hospitals, where medical interventions such as epidurals, inductions, and cesarean sections are common. 2. Medical interventions. Understand the types and frequency of medical interventions used during childbirth, such as continuous fetal monitoring, labor augmentation, and episiotomies. 3. Maternal and neonatal outcomes. Review current statistics on maternal and neonatal health outcomes, including rates of cesarean sections, maternal mortality, and infant morbidity. Step 2. Exploring historical and cultural birth practices. 1. Traditional birth practices. Investigate how childbirth was historically managed before the advent of modern medical interventions. Consider the roles of midwives, home births, and natural birthing techniques. 2. Cultural variations. Study different cultural approaches to childbirth around the world, noting how practices and outcomes vary in different settings. 3. Evolving practices. Examine how childbirth practices have evolved over time and the reasons behind the shifts towards more medicalized births. Step 3. Evaluating the impact of medical interventions. 1. Benefits and risks. Analyze the benefits and risks associated with common medical interventions during childbirth. Consider both short-term and long-term impacts on mothers and babies. 2. Cesarean sections. Investigate the reasons behind the high rates of cesarean sections and their potential overuse. Explore the implications for maternal recovery and future pregnancies. 3. Epidurals and pain management. Review the effects of epidurals and other pain management techniques on the birth process and maternal satisfaction. Step 4. Considering alternatives to medicalized birth. 1. Midwifery. Care. Explore the role of midwives in providing personalized and holistic care during pregnancy and childbirth. Assess how midwifery care compares to obstetric care in terms of outcomes and patient satisfaction. 2. Home births. Examine the safety and outcomes of planned home births with trained professionals. Compare these with hospital births in terms of maternal and neonatal health. 3. Birth centers. Investigate the role of birth centers as a middle ground between home and hospital births, offering a more natural birthing environment with access to medical support if needed. Step 5. Emphasizing the importance of informed choice. 1. Education and empowerment. Stress the importance of educating expectant parents about their birthing options and the potential risks and benefits of different interventions. 2. Informed consent. Highlight the need for informed consent and shared decision-making between healthcare providers and parents. Encourage open communication and respect for parents' preferences. 3. Birth plans. Advocate for the use of birth plans to help parents articulate their preferences and ensure their wishes are considered during labor and delivery. Step 6. Supporting a shift towards a balanced approach. 1. Evidence-based practices. Promote the adoption of evidence-based practices in maternity care, ensuring that interventions are used appropriately and only when medically necessary. 2. Holistic care. Encourage a holistic approach to childbirth that considers the physical, emotional, and psychological needs of the mother and baby. 3. Continuity of care. Support models of care that provide continuity, such as midwife-led care or collaborative care teams, to improve outcomes and patient satisfaction. Step 7. Advocating for policy changes. 1. Healthcare policies. Advocate for healthcare policies that support diverse birthing options, including access to midwives, birth centers, and home births. 2. Insurance coverage. Push for insurance coverage of all types of maternity care providers and settings to ensure that parents have access to their preferred birthing options. 3. Research and funding. Support increased research and funding for studies on alternative birthing practices and their outcomes to build a stronger evidence base. Step 8. Encouraging community and professional support. 1. Support networks. Build community support networks for expectant parents, including prenatal education classes, support groups, and postpartum resources. 2. Professional training. Ensure that healthcare professionals receive training in both medical and alternative birthing practices to provide comprehensive and respectful care. 3. Public awareness. Raise public awareness about the benefits and availability of different birthing options through education campaigns and advocacy efforts. By examining and challenging current practices, promoting informed choice, and supporting a balanced approach to childbirth, we can work towards a system that better meets the needs and preferences of all parents and babies.